Hi everybody, welcome to Parent Support or Facebook Live. My name is Sarah, and before we start talking to Lisa from SeeAbility, I'll just explain a little bit about Parent Support for those of you that don't know. Parent Support is a free resource for parents and carers of children who have a disability or special additional need. And it's a one-stop shop where you can go and find out information on a whole range of topics, from finances to therapies to educational topics. And if what you're looking for isn't there, please get in touch and we can hopefully point you in the right direction. So welcome, Lisa from SeeAbility. Nice to see you.
Thank you, Sarah.
Just start off by telling us a bit about yourself and about SeeAbility, and we'll go from there.
Thank you, Sarah. And yeah, it's great to have this opportunity to share the work that SeeAbility do, and I hope it's going to be useful to everybody. I'm an optometrist, and I've been going into special schools providing eye care for over 20 years now. As part of my role as an optometrist, I've also worked in hospital and in high street opticians, and I've also practiced in teaching at City University, teaching undergraduate optometrists. But I'm really passionate about the eye care needs of people with learning disabilities, and that's where the work in special schools has come in. And I've been very fortunate to be part of the charity SeeAbility. SeeAbility is a 220-year-old charity that was originally the Royal School for the Blind, and so it was an institution 200 years ago. Nowadays, people whose sole disability is sight loss usually are living independently. What we do as an organisation now is support people with sight loss and additional disabilities. And one of the things that we found as a charity was so many of the people that we were supporting had problems with their eyes, obviously, and those problems were often not well understood, and their eye care needs were often not well met. So about 15 years ago now, we started a campaign called Look Here, which was about supporting everybody with a learning disability to access an equal right to sight. So it was a combination of working with people with learning disabilities, their supporters and carers, to ensure that they were getting eye care. One of our key messages is no one is too disabled to have an eye test. And it's had to be a sort of multi-pronged approach, because we were supporting people to go and try and access eye care. And often carers, supporters, parents make an assumption that an eye test is sitting still in a room full of expensive equipment, reading down the letters and choosing whether number 1 or number 2 is clearer. And that's obviously, often people think, well, my child or my parent, whoever it may be who they're supporting, couldn't do that, so they just don't take them. So a lot of it's been around how reasonable adjustments can be put in place to make sure everyone can get their eyes checked. And it's also been about educating the eye care professions as well, because unfortunately sometimes people do go for eye care and their needs aren't adequately met by high street opticians or by hospital services. So we've been sort of working closely with the eye care sector as well as with the learning disabled population. Then we were the next step, which is where I became involved closely with the charity, was in 2013, when we decided to do a research project, going into special schools to find out whether children's eye care needs were adequately being met. NHS England had always argued that everyone was entitled to, every child under 19 in full-time education was entitled to free eye care, and they should be accessing it. But we weren't convinced from families that we were talking to that was always happening. So we started this project going into schools, and when we got to just under 1,000 children, we published our findings, and we found that half of the children had a problem with their eyes.
Wow.
So it was 50-50 chance that you're going to have something going on that needed further support or investigation. And yet 44% of the children had no reported history of any eye care at all.
Wow.
So and only just under 10% had ever been to a high street optician. So if eye care was being accessed by the children basically with the highest need, it was usually being accessed in a hospital setting. And yeah, 44% were missing out. And we were finding some quite shocking case studies, actually. Teenagers who couldn't see beyond a few centimetres from their nose just for want of a pair of glasses. So yeah, we had one young man, just as a sort of a kind of a story to bring it alive, a young man who I met when he was 14. He was in a behaviour class with severe autism, profoundly deaf, and his mum had written on his history form, "You won't be able to test him. He's got no useful means of communication." I had to go to him in his classroom to try and look at his eyes, and it transpired that he was about -14, and I could only see that by holding a torch sort of at arm's length from him. So I couldn't do a full eye test, but I could see enough to see that he was very, very short-sighted. So when you're -14, that means you can't see beyond 6 centimetres. So he was registrable as blind from his level of functional vision. And he was going up to other students and getting really close into their face, and that was seen as a sign of aggression, when actually he was trying to have some kind of communication engagement. So we managed to do that. We didn't manage to try any glasses on. We just had to order a kind of guess best fit pair of glasses. And fast forward to now, and Nathaniel is in college learning BSL. He communicates. He went through he communicates through widgets. Like I say, now he's using BSL. He wears his glasses all the time. He loves his glasses. He's got 20/20 vision. He matches pictures to tell you what he can see. And to use his family's words, he's less autistic. So his behaviours have massively improved, obviously, because he can see. And he's wearing his hearing aids better, and so his life sort of, just for a pair of glasses, has taken a really positive turn. So so yeah, that's the sort of work that we did from sort of 2013 to 2018. We're still in all those schools. We're still going in and providing a service. During that time, as well as publishing our sort of research evidence from what we were finding from the students, we also got all of the eye care bodies together to develop a framework, so kind of a model of what eye care should be like for this population. So, because it's very easy to say it's not working, but we wanted to try and find a potential model for what would be best practice to make sure that everyone was getting their eye care needs. There's Public Health England, which doesn't exist anymore as of the 1st of April, but it's sort of been morphed into a new organisation. But the National Screening Committee and Public Health England recommend that local authorities should commission vision screening as part of the Healthy Child programme for every child in school. So in most mainstream schools, at school entry age, you'll get a vision screen. But unfortunately, it happens a little bit in special schools, but because the screening is often carried out by school nurses, and because it's a once only visit, it's often not happening in special schools because the service isn't adequate. And so instead of getting more frequently, special schools are actually getting a lot less. They're getting nothing. And the knockback sometimes to us was that most of them will be under hospital, but that was where we showed that only 44% were. So, and often they were going to hospital for basic eye care, which could be managed. They don't need to see the full multidisciplinary team and an ophthalmologist who's an eye surgeon. They just need, they could have their needs met for their routine care in the community or in the school. So it was agreed by the framework group, all the eye care bodies, that the best model would be to have eye care provided in the school setting where the children are more relaxed and where their assessment can take place without the sort of the time and the clinical pressures of hospital visit, for all sorts of reasons. Children who, as you will all know, when you're child has developmental problems, you're going to every single clinic under the sun and so to have things come to school can be really helpful, and that's why often you have speech and language teams, occupational therapy teams who are coming in. So it was agreed that the model that was necessary was a service in school, and the other elements of that model that were recommended was very critically was that it would include glasses if a child needed them. So what happens in most hospital clinics and in any existing services is if a child does need glasses, very often they're given a prescription and then that has to be taken to an optician's to get made up into glasses. And my personal experience of that when I used to do a clinic without the glasses bit was I would see a child, write out the prescription, and then 6 months later they wouldn't be wearing them. They'd either got lost or broken, or the parents had tried them and the child didn't get on so well with them and they'd got abandoned. So this model is all about having that glasses support as part of the service. The other thing that was agreed was that screening wasn't going to work, and we kind of looked at so vision screening, as I said, for the recommendation for all children is that you cover one eye and read down the letters or pictures, and then cover the other eye the same. So we looked at all the school entry age children, and unsurprisingly, only one of about 253 children was able to pass screening. So screening is, if you went in to screen and all you did was screen, you'd end up sending everyone on to a secondary service. So all these children, to really work out what's going on. And like we said, you don't screen for something where there's a 50-50 chance of a problem either. So that's not what, you screen for things that are a little bit rarer. So that was why it was agreed that they needed a full eye test, including measuring the eyes for glasses, including checking the health of the eyes, and including doing, really importantly as well, the model involves writing a plain English report of the child's visual abilities, needs and limitations. So if they have limits to their vision, how limited is it? So you would include the size of things that the child can manage, if they need things to be uncluttered, if they need good lighting, if they need to sit on a certain side of the class. Some children have nystagmus, where their eyes wobble a little bit, and often with nystagmus you'll have what's called a null point. So when you get your eyes into a certain position, they'll wobble a little bit less. So for those children, it's really important that they can look at things from that position. So if I need to look this way, I need to be on this side of the class. Otherwise, I'm trying to turn my head right round to get a look at the teacher. Likewise, 30-40% of children with cerebral palsy will have what's called a hemianopia, which is when your vision is cut in half. So a bit like hemiplegia, but you lose the whole, and it's much more disabling than closing one eye, because literally it's happening in the brain. So the left side of both eyes is completely lost. So anything on that side has to come right past the midline before the child is able to see it. So for a child with a hemianopia, it's really important that that's understood. And often what happens is they'll have some medical records, and somewhere it will be written down, this child has a total left hemianopia, but that doesn't get translated into anything meaningful in school. Whereas what we will write is, this child cannot see anything to the left of centre, therefore they need to sit on the right side of the teacher, and they need to, for example, if they use a headrest, often we'll write to the physios directly, because the physios will be doing their best to support the child to have their neck nice and straight, because that's what they're thinking about. And the child's desperately trying to turn their face a bit so that they can see a bit more, and then the physios are, with all the best intentions, are straightening them up again. So we just drop them a line and explain, I think they'd benefit from having their head supported, slightly turned. So that's where it's great being part of that multidisciplinary team in school. So the framework paper described that model, and we gradually morphed into providing it.
Wow.
And in 2019, when NHS England released their long-term plan, thanks to lots of sort of lobbying from my colleagues at SeeAbility as well, and the work we were doing, NHS England recommended that model and made a commitment to roll it out in all special schools. And they also added audiology and dental care to that, so that was really nice. So we're now, having been a campaign and a research project that was funded with fundraised and grant-raised income, we're now a fully funded part of that new NHS service, which is just starting to be rolled out in it's been in the northwest first, now it's starting in London, and it will be in the northeast of the country next. So it's in sort of NHS regions, which is, yeah, very exciting. So that's that was quite a long introduction, but that's great.
Yeah. Special needs children in the mainstream, can they access it or not?
That's a very good question. For special needs children in the mainstream, if they're in a unit that's attached to a mainstream school, then that will be considered to be a special school, so that unit should get provision. The other thing that we continue to campaign for is an equitable service in community practices. So what we'd really like to see, and this is where it gets all a bit complicated with the way services are commissioned, and I don't want to have to bore you with all of that, but basically NHS England mainly only commission a basic eye test. So when you go to an optician's and you get that free under 19s eye test, it's a basic check of the eyes and help, and you get a voucher towards glasses if needed. More increasingly now, what's happening is CCGs, the clinical commissioning groups, or as they will be, integrated care systems, ICSs, are commissioning additional services. So one of the most common ones is a minor eye condition service. So if you have a red eye or a sticky eye, or you have flashing lights or any kind of minor eye emergency, rather than going to eye casualty, the person with the problem will get sent by their GP to a minor eye conditions trained optometrist in a high street opticians. So they will go there. So that was the first one of these services, and now we've got services like that for cataract referral refinement, to make sure people get counselled that they really want surgery, to try and help with cataract surgery waiting lists. And we have it for glaucoma and other things. So we've worked with MenCap and with again the eye care bodies to design a community learning disability pathway. So that would be for all ages, and it's actually commissioned across the Greater Manchester area, and in parts of Cheshire and Merseyside, and in Sutton in London, Barking and Dagenham, but and Durham, Darlington and Tees. They're all the areas where it is at the moment, but we're really pushing for that to get commissioned everywhere. So what that means, and you can look at our SeeAbility website for more information, is you go to a specially accredited optometrist, opticians, who is providing an enhanced service. So they're a specialist in seeing, they've done additional training for seeing people with learning disabilities. And that means that they fill out similar forms to the school ones, so they explain the child's visual abilities and needs. They're sort of contractually obliged to provide longer tests, to have more learning disability friendly tests and equipment, etc. So that's not as far along. The special school stuff is definitely getting rolled out, but we're really hopeful. This is our sort of second stream, is to get these community eye care pathways commissioned across the country. And the sort of long-term goal is for GPs to refer into it. So everyone with a learning disability over 14 is entitled to go and get an annual health check with their GP. So what would be ideal is if they were signposted to get their routine eye test from that as well, to a participating practice, so it's all joined up in the community.
So historically, those with additional needs, are they more likely to have an issue with their eyes or need glasses, or is it just that they are less likely, as you say, to have their eyes tested and be picked up?
No, Sarah, that's a really good point that I don't think I mentioned at the beginning, which I normally do. But the whole reason that people with learning disabilities, eye care needs, is such a vital issue is that children with a learning disability are 28 times more likely than their peers to have a significant eye problem. And for adults, it's 10 times more likely. So yeah, there's good evidence that the risk of eye issues is much, much higher, and yet you're much less likely to access the eye care you need. So it's a real double whammy.
Oh,
yeah.
Okay. Let me think. What else?
I can see someone's. Shall I answer? There's a question. Accessing eye services resulting in delays in getting things diagnosed. Unfortunately, yes, it does. So, yeah, does difficulty accessing services like eye tests result in a delay in vision problems getting diagnosed? So exactly, I mean, I mentioned the young man Nathaniel, who was 14 before his vision problems got diagnosed, and it's not unheard of for adults to have gone their whole life without having a problem diagnosed. So unfortunately it does, and as we said, those problems are so much more likely. So if you're premature, for example, you're very much more likely to be short-sighted, and as we know, you're much more likely to be short-sighted with autism as well. So
if you were a parent, and I am a parent of a special needs child, as you, in the example you gave about the boy going very close up to people, are there any other things that parents could be looking out for that might give them a hint, that might be misinterpreted as a behaviour that could be a clue that the eyes need to be investigated?
Yeah, again, that's a really good question. I mean, I think the caveat to that, yes, there definitely are, but the other thing I would say is it can be really, really hard to tell, and it's amazing how often parents will say, oh my goodness, I had absolutely no idea he had a problem with his vision, just hadn't. So it can be really hard to spot. But yes, there are signs. So one of the key things is if the eyes aren't lining up.
Okay.
So if one eye is turning in or out, signs that sometimes children might not be able to control their eye movements very well, so they may not look where you expect them to, and that may be not just because they're ignoring you, it may actually be because they're struggling to move their eyes. In terms of kind of focusing things, there's often a really strong, we always call it diagnostic overshadowing, where if, for example, attention, so often people are ADHD, described as having really poor concentration, or parents will sometimes say, he's got no patience with a task. And that can often be because it's really hard to see what they're doing. So always thinking if a child isn't enjoying doing something that has a visual element, could it be because they can't see it? It may be that it's an attention issue, but it is also possible that it's just really, really hard to keep it in focus, or they can't get it in focus, and that must be really annoying. So, that could be a reason why a child loses patience with looking at a book or looking at an iPad, rather than the fact that they haven't got the attention span. And so that's really important. Attention, I think, is vital. Then the other really big area of issues which aren't as easy to correct as short-sightedness, long-sightedness, and focusing issues is cerebral visual impairment, which is a condition where very often families have been to a hospital eye clinic and been told your child's eyes are perfectly healthy, but they come away really confused because they know that their child doesn't see normally. And there's a fantastic video on YouTube by a young man called Alfie Fox, and if you just Google Alfie Fox how I see, you'll find him, and he describes CVI so much better than I can. But it's different for every person who experiences it, but it's about the brain not being able to process the visual image in the way that you or I do. So it can affect people in a multitude of ways, from being almost totally unable to see at all, to struggling with following a moving target, being able to judge depth and distance, being able to judge things when there's lots of visual clutter, challenges with perceiving colour, so all sorts of. So I think, you know, if there's issues with the way a child is behaving in terms of the way they seem to be perceiving things, then CVI is something. Cerebral visual impairment is definitely a, you know, something to explore. And again, it's not something that in a lot of, certainly in high street opticians, but even in hospital eye clinics, it's not always considered as a possible diagnosis. And yet it is the number one reason for children in England to be certified as visually impaired. So it's a bit bizarre, because it still often goes undiagnosed. There was actually a big study just recently released about cerebral visual impairment, which evidenced that 1 child in 30 has a degree of CVI. So in the special school population and in children with an EHCP, that's going up to, you know, probably at least 1 in 3, maybe even more. So it's really likely to have some kind of processing issues.
Yeah. Okay. Just something from with my own son. When you were talking about the, you know, eyes being straight, I sometimes couldn't see it when I looked at him, but when I looked at photographs of him, I would.
Yeah.
So sometimes as a parent, if you look at a photograph and think, wow, that eye is really turning in or turning out, and you look at them and you can't see it normally, if you see it a couple of times on a picture, I think that would be, would you agree, time to sort of check?
That's a very good point, Sarah. And that's what we will often say to parents when, you know, when they're coming to a clinic and there's a query about a squint, is, you know, see if you can get some. It's great now we've got phones because people can flick through and look. And sometimes you get what's called a pseudo squint, where the folds of skin are asymmetrical. And children with Down syndrome are particularly likely to have a squint, a strabismus, but they're also particularly likely to have a pseudo strabismus as well.
Okay.
So what happens there is one side is slightly more covered over than the other, so you get this appearance of a squint when actually the eyes are straight. So what we look for in the photos is the light reflex. So the where you get the reflection in the center of your eye, whether they're central. And those photos, when an eye is turning, you'll often see that one eye's got a central reflection, and the other eye, the reflection of the camera light is right off to the side. And that's a definite sort of sign. But no, that's a really good point. And squints that are real will always look worse when a child is tired, or not always, but they often will look worse when a child is tired, and they may come and go, whereas the pseudo type tend to be there more often. And of course, some children, if they have a problem with one of the eye muscles, or you know, there's some problems, then their squint can look worse when they're looking in different directions as well. So that can be. But yeah, the squint is definitely one to look for. The poor attention, obviously peering at things. I mean, that one of the interesting things for all children. And this, you know, isn't just about children with special needs as well. The reason that we need a vision screening program and that it's been recommended is even when their vision is quite poor, every child will tend to strategize and tend to, that's their normal. So unlike a much older child who will be able to tell, and as you said to me before, Sarah, your son was able to say, I can't see the board as well. That won't happen when they first need glasses, because their normal has been, you know, it's been below par, if you like. So children will often be able to report a deterioration, but if they've never had good vision, then they won't tell you, I can't see well. And it's amazing, again, how sometimes you can see a child with really quite poor vision who's just been coping and has never, you know, they've never complained, I can't see that. So, I mean, we do the other sort of functional clues as well, are kind of pointing things out in the park. You know, if a child really likes dogs, or, you know, do they spot them at a distance, or are they able, one of the things I will often ask is, does a child recognise you across the room or across the classroom before you say anything? And then people will be like, oh gosh, I always come in and say, oh, Nikki, and they don't realise that they're always speaking. So then they'll go away and try it without speaking. So that's that's an important functional thing as well, to see if they can spot things at a distance.
I remember being in the zoo with Finley and him looking at a tree and thinking there was an animal there and there wasn't, and thinking,
Really?
oh, I don't think he could see very well. We've got more questions if you're okay to answer those.
Yes. Yeah, I see Blue Sky Neuro's asked about knowing more about CVI. So, like I said, I'd really recommend the Alfie Fox video, and I'd really recommend if you Google the CVI Society, and the Scottish CVI Society has got some great information online. So, yeah, it's so much more than I can fit in here to learn about CVI. So do go and they're great sources as a starting point. We do also have some information on CVI on our website as well. But the CVI Society is really good. And then Olivia's asked about products and educational tools that can be used at home or in school to help maintain or even improve a person's vision. I think, yes, generally schools, and it totally depends on the child. So in a way, it's about working with their eye care practitioner to know what level they're at. So I was talking about children with the most profound cerebral visual impairment, children who've been registered as severely sight impaired or blind because they don't seem to have very much visual response at all. There's lots of work going on with those children now in tents, in coloured tents. So the children, and actually schools have been doing it in sensory rooms where you just have a plain coloured background and then introduce single, very simple flashing balls or so ultraviolet is particularly good for children with cerebral visual impairment to stimulate them. But really for that end of the spectrum, we can start to see visual responses in a child who hasn't been visually responsive with those. So UV definitely really important, and just really simple background and then a large bright toy being introduced. And on the other end, if a child has got much better vision, and again, there's a whole spectrum, but one of the things that's developing a lot now is actually to support children's binocular vision is 3D computer games. So they can be a really good way of getting the eyes working together and of stimulating detailed vision. But you've got to meet the child at the right point. So if the child hasn't yet got good enough vision to cope with that game, it's not going to work. So the first step is understanding what their level of vision is, and then stimulating them at their threshold. So there's a great tool called the Bradford Visual Function Box, which Rachel Pilling, who's actually Professor Rachel Pilling now, she's the first Professor of Learning Disability Eye Care, and she's been a wonderful advocate of Learning Disability Eye Care for a number of years now. And she's developed a tool which is basically a series of different size beads and balls so that you can better quantify a child's functional level of vision. So we can show a parent, at the moment they need the 20 centimetre ball. Now they're managing with 10 centimetres, or, you can get right down to a 5 mil bead to follow. So that's another really good tool as well. And you can find out more about the Bradford box on our website as well. So,
Brilliant. Thank you so much. It's been a lot of information, but it's been really interesting, and what you've achieved so far is so many children are going to benefit as it's rolled out in those areas, and then, as you say, hopefully across the whole of the UK. So thank you for talking to us. If you've said about the website, people can find more information. If you've got anything else to send us, we'll obviously post it up on Parent Support too. But thank you very much.
It's an absolute pleasure. Thank you so much, Sarah, and everybody for listening. It's great to be able to share our work. And I mean, one final thing I'd want to say as well is, if you do have a child who attends a special school, then make sure you're encouraging the school to take up the services as if and when they're getting offered. So sort of, if NHS England are starting to offer the services, and not all schools are always taking that up straight away. But so if parents are asking for it, that's a massive help to make sure that these services get established. So thank you.
Thanks very much.
Thank you, Sarah.
All right, I think we are. Hold on.